What if I told you that 73% of people over 60 are experiencing a deadly warning sign right now, and they have no idea? In fact, you might be experiencing it yourself while watching this video. But here's what's really shocking. The most dangerous symptom isn't chest pain or shortness of breath. It's something so common, so seemingly harmless, that even doctors missed it until recently. Last week, a viewer commented, "Sign number 5 saved my husband's life. We thought it was just aging. Today, I'm revealing all 7 medical warning signs that appear months before a health crisis. Signs that could literally be the difference between celebrating your next birthday or not." And warning sign number 3, it's probably happening to you at 3 a.m. Let's make sure you recognize it before it's too late. Meet Richard Hoffman, a 72-year-old retired electrician from Denver. 3 months ago, Richard was planning his dream Alaska cruise with his wife when he started experiencing what he called weird little things. A metallic taste in his mouth, occasional double vision, pants feeling tighter despite losing weight. Like most people his age, Richard blamed it on getting older. "I've been through Vietnam, raised 4 kids and worked construction for 40 years, he told his doctor. "A little discomfort is normal, right?" Wrong. Richard's little things were his body screaming for help. Within 6 weeks he was diagnosed with 3 serious conditions that, if caught earlier, could have been managed simply. Instead he spent his cruise money on medical bills and missed his granddaughter's wedding. The truth is, after 60, your body becomes an expert at sending subtle distress signals. But here's what most people don't know. These signals often appear 3 to 6 months before a major health crisis. The CDC reports that 68% of preventable deaths in seniors could have been avoided if warning signs were recognized earlier. Today, you'll learn exactly what to watch for. These aren't generic symptoms like chest pain or difficulty breathing. Those are obvious. We're talking about the sneaky signs that masquerade as normal aging. And yes, you might have experienced some of them already. Before we dive in, hit that notification bell so you never miss life-saving content like this. Your future self will thank you. Number 1, the silent thief. Subtle vision changes. You're reading the newspaper one morning and the words seem slightly blurry. You blink, rub your eyes, and it clears up. No big deal, right? Actually, this could be your first warning. Dr. Sarah Martinez, a neuro-ophthalmologist at Johns Hopkins, explains, after 60, sudden vision changes, even temporary ones, are red flags we can't ignore. They're often the earliest sign of stroke, diabetes complications, or even certain cancers. Richard Hoffman experienced this firsthand. I'd be watching TV and suddenly it looked like I was seeing double for just a second. I figured I needed new glasses. But those split-second episodes were actually mini-strokes, warning him of a larger event brewing. Here's what to watch for. Temporary blind spots or dark patches, brief double vision episodes, seeing halos around lights at night, difficulty tracking moving objects, and one eye seeming lazier than the other. The scary part? These symptoms often last just seconds or minutes, making them easy to dismiss, but they're your retina's SOS signal. The blood vessels in your eyes are incredibly sensitive to changes in blood pressure, oxygen levels, and blood sugar. When they struggle, it's often a preview of what's happening throughout your body. Patricia Williams, 69, noticed floaters in her vision that seemed different from the usual ones. These looked like black threads, not the typical clear squiggles, she recalls. Her optometrist immediately sent her to the ER, where they discovered her blood pressure was 190/110, stroke territory. What makes vision changes particularly dangerous after 60 is their connection to systemic issues. Your eyes share blood supply with your brain. When eye doctors spot changes in your retinal blood vessels, they're essentially getting a sneak peek at your brain's vascular health. When was your last comprehensive eye exam? Share your experience below. Action steps. Schedule a dilated eye exam every 12 months after 60. Keep a vision diary. Note any unusual changes, even if brief. Never ignore sudden vision changes, even if they resolve quickly. Ask your eye doctor to check for signs of vascular changes. And if you experience vision changes with headache or dizziness, seek immediate care. Remember, your eyes aren't just windows to your soul, they're early warning systems for your entire body. Don't let their whispers go unheard. The Midnight Visitor. Unexplained night sweats. Carol Davidson, 65, thought menopause was playing a cruel joke when she started waking up drenched in sweat. I'd gone through menopause 15 years ago, she says. But suddenly I was changing pajamas twice a night again. She bought a cooling mattress pad, blamed it on her new medication and tried to ignore it. 6 weeks later, she was diagnosed with non-Hodgkin's lymphoma. Night sweats after 60 aren't just inconvenient, they're your body's distress flare. Dr. Michael Thompson, an oncologist at Cleveland Clinic, warns, when someone past menopause starts experiencing drenching night sweats, we immediately investigate. It's one of the earliest signs of several serious conditions. Here's what makes post-60 night sweats different from hot flashes. They're drenching, requiring clothing or bedding changes. They're often accompanied by unexplained weight loss. They may include a low-grade fever. They can have a distinct odor, and usually they persist for weeks without improvement. The sinister truth? Night sweats can signal blood cancers like lymphoma or leukemia, solid tumors, serious infections like TB or endocarditis, autoimmune disorders, thyroid problems, and certain medication interactions. Frank Peterson, 71, dismissed his night sweats for months. I figured it was just my blood pressure medication, he remembers. But when his wife noticed he'd lost 15 pounds without trying, she insisted on a doctor visit. Tests revealed early-stage lymphoma. If we'd waited another few months, treatment would have been much harder, his oncologist said. What's particularly tricky about night sweats is their pattern. They often start intermittently, maybe once a week, then gradually increase. By the time they're nightly, the underlying condition has often progressed significantly. Dr. Thompson shares a sobering statistic. About 30% of lymphoma patients report night sweats as their first symptom. Yet most wait 3 to 6 months before seeking help. Have you experienced unexplained night sweats? What did you discover? Share below. Red flags that demand immediate attention. Night sweats with unexplained weight loss. Night sweats with a persistent low-grade fever. Night sweats with swollen lymph nodes. Night sweats with extreme fatigue. And night sweats with itchy skin without a rash. Here's your action plan. Keep a night sweat diary noting frequency, severity, and associated symptoms. Note any new medications started in the past 3 months. Check for swollen lymph nodes in the neck, armpits, and groin. Monitor your weight weekly. See your doctor if night sweats persist beyond 2 weeks. The good news? When caught early, most conditions causing night sweats are highly treatable. Carol Davidson? She's now in remission, traveling the world with her grandkids. Those night sweats saved my life, she says. My body was literally crying for help. The Shapeshifter. Rapid weight changes without trying. At 67, George Thompson stepped on the scale and grinned, down 12 pounds without changing anything. His pants fit better, his wife complimented his appearance, and he felt like his younger self. But his celebration was premature. 3 months later, he was diagnosed with pancreatic cancer. Dr. Jennifer Walsh, a geriatric medicine specialist at Mayo Clinic, doesn't mince words. Unexplained weight loss after 60 is guilty until proven innocent. The same goes for sudden weight gain. Your body doesn't dramatically change weight without reason. Here's the harsh reality. After 60, unintentional weight loss of more than 5% of your body weight in 6 months is a medical emergency. That's just 7.5 pounds for someone weighing 150 pounds. Yet most seniors celebrate it as a victory. The most dangerous weight changes include, for weight loss, losing 10 or more pounds without trying, clothes becoming loose despite normal eating, muscle mass visibly decreasing, losing weight while eating more, weight loss with increased thirst. These can signal various cancers, especially GI tract, hyperthyroidism, diabetes, heart failure, chronic infections and dementia. For weight gain, Gaining 10 or more pounds rapidly, swelling in legs or ankles, breathlessness with weight gain, tight rings or shoes and abdominal distension. These can indicate heart failure, kidney disease, liver problems, thyroid issues and medication side effects. Linda Martinez, 70, noticed her wedding ring getting tight. "I thought I was just snacking too much," she admits. But when her ankles started swelling, her daughter insisted on a checkup. The diagnosis? Early heart failure causing fluid retention. 20 pounds of my weight gain was actually fluid, Linda learned. The insidious part? Weight changes often come with built-in denial. We blame aging metabolism, changed activity levels, or seasonal eating patterns. But Dr. Walsh emphasizes, your body weight should be relatively stable after 60. Significant changes always warrant investigation. Have you noticed unexplained weight changes? What was the cause? Help others by sharing. Here's what doctors actually look for. Rate of change, whether gradual or rapid, accompanying symptoms, appetite changes, bowel habit changes, and energy levels. Donald Williams, 73, provides a cautionary tale. His wife noticed he'd lost weight but was eating more than ever. "I was thrilled to eat whatever I wanted without gaining," he says. The cause? Undiagnosed diabetes causing his body to literally waste away despite increased calories. Your weight tracking action plan: weigh yourself weekly at the same time. Keep a simple log. Note any changes in appetite or eating habits. Monitor how clothes fit. Take monthly photos for visual comparison. Report 5 or more pound changes to your doctor. Dr. Walsh's bottom line: never celebrate unexplained weight loss after 60. And never dismiss unexplained weight gain. Both are your body's billboard advertising that something's wrong. The silver lining? When caught early, most conditions causing weight changes are manageable. George Thompson's pancreatic cancer was caught at stage 1, extremely rare and treatable. That unexplained weight loss I was so happy about, it saved my life by making us investigate. The memory thief, beyond normal forgetfulness. When Nancy Rodriguez, 68, couldn't remember where she'd parked at the grocery store, she laughed it off. When she forgot her grandson's birthday, she blamed stress. But when she called her daughter by her sister's name, repeatedly, her family took notice. 6 months later, Nancy was diagnosed with early-stage vascular dementia. Dr. Robert Chen, a neurologist specializing in memory disorders, clarifies a crucial distinction. Normal aging includes occasional forgetfulness. Pathological memory loss follows specific patterns that families often miss until it's advanced. Here's what separates normal aging from serious concern. Normal aging: forgetting names but remembering them later, misplacing items occasionally, needing lists more often, taking longer to learn new things, forgetting details of conversations, warning signs, forgetting recently learned information repeatedly, asking the same question multiple times within minutes, getting lost in familiar places, putting things in bizarre places like keys in the refrigerator, forgetting how to do routine tasks, confusion about time, date or season, difficulty finding common words, poor judgment with money, withdrawing from social activities, personality changes. Samuel Foster, 71, experienced what his wife calls the grocery store incident. He'd shopped at the same store for 20 years, she recalls. One day he called me crying. He couldn't find the exit. He was standing right next to it. What makes memory issues particularly dangerous after 60 is their variety of causes: Alzheimer's disease, vascular dementia, medication interactions, thyroid problems, vitamin B12 deficiency, normal pressure hydrocephalus, depression, and urinary tract infections in seniors. The shocking truth? Up to 40% of dementia cases are preventable or reversible if caught early. Yet most families wait 3 to 4 years before seeking help. Dr. Chen shares a critical insight. The earliest sign isn't forgetfulness, it's the strategies people develop to hide it. They stop cooking elaborate meals, avoid social situations, let spouses handle finances. The adaptation often precedes the obvious symptoms. What memory changes worry you most? Share your concerns below. You're not alone. Here's your memory assessment checklist: forgetting appointments despite reminders, difficulty following TV plots or book storylines, trouble managing medications, confusion when plans change, mixing up family members' names regularly, forgetting significant events like weddings or funerals, inability to retrace steps when something's lost. Betty Anderson's story offers hope. At 66, she noticed she couldn't follow recipes anymore. I'd made the same casserole for 40 years. Suddenly I couldn't remember if I'd added salt, she says. Testing revealed severe B12 deficiency, completely reversible with supplements. My memory returned within weeks. If I'd waited, assuming it was just aging, permanent damage could have occurred. Action steps for memory concerns. Start a symptom journal immediately. Have a trusted person observe your behavior. Get a complete medication review. Request cognitive testing. Rule out reversible causes first. Consider a neurological evaluation. Dr. Chen's most important advice. The worst thing you can do is wait. Early intervention can slow progression by years, sometimes decades, and if it's reversible, you'll get your life back. Nancy Rodriguez mentioned earlier, early intervention preserved her independence for 5 additional years. Those 5 years included my daughter's wedding, 2 grandchildren's births, and our 50th anniversary cruise, she reflects. Early detection gave me priceless time. Number 5, the energy vampire. Extreme fatigue that rest doesn't fix. David Chang, 69, was a marathon runner who'd completed 30 races. So when climbing stairs left him breathless, he knew something was wrong. I'd sleep 10 hours and wake up exhausted, he recalls. Coffee didn't help. Naps didn't help. Nothing helped. His wife jokes darkly. He went from running marathons to barely managing a marathon of Netflix. David's extreme fatigue was the first sign of acute leukemia. Dr. Patricia Moore, a hematologist at Stanford, explains, fatigue after 60 isn't just about getting older. When rest doesn't restore energy, when tired becomes exhausted, when exhausted becomes debilitated, that's your body waving a red flag. Here's what distinguishes dangerous fatigue from normal tiredness, normal aging fatigue. Feeling tired after activities, needing more sleep than when younger, taking longer to recover from exertion, afternoon energy dips, improved by rest, warning sign fatigue, exhaustion upon waking, unable to complete normal activities, breathlessness with minimal exertion, fatigue that worsens over weeks, not relieved by rest or sleep, accompanied by other symptoms, interfering with daily life. The statistics are sobering. 73% of people over 60 experience pathological fatigue before major illness diagnosis, yet most dismiss it as part of aging for months. Maria Patel, 71, describes her experience. I thought I was lazy. I'd been a teacher for 40 years, always energetic. Suddenly, making breakfast exhausted me. I'd rest on the couch after showering. My daughter finally dragged me to the doctor. Diagnosis: severe anemia from undetected colon cancer. The sinister causes of extreme fatigue include heart failure, reduced oxygen delivery, anemia from various causes, thyroid disorders, sleep apnea, chronic infections, cancers, especially blood cancers, kidney disease, liver problems, medication interactions, depression. Dr. Moore shares a crucial pattern. Fatigue from serious illness typically follows an escalating pattern. Week 1, tired. Week 3, exhausted. Week 6, can barely function. Normal aging fatigue remains stable. Describe your energy levels throughout the day. Notice any patterns? Share below. Critical red flags requiring immediate attention: fatigue plus shortness of breath, fatigue plus chest discomfort, fatigue plus rapid weight loss, fatigue plus persistent fever, fatigue plus night sweats, fatigue plus bruising easily, fatigue plus confusion. Roger Wilson's story illustrates the danger of delay. The 72-year-old former construction worker prided himself on toughness. I'd worked through broken bones, kidney stones, you name it, he says. But when fatigue forced him to rest after walking to the mailbox, his wife intervened. Tests revealed congestive heart failure. My tough-it-out attitude nearly killed me, he admits. Your fatigue? Evaluation plan 1. Rate energy levels daily, 1 to 10 scale. 1. Note when fatigue is worst 1. Track sleep quality and duration 1. Monitor what activities exhaust you 1. List all medications and supplements 6. Document associated symptoms 1. Compare current energy to 6 months ago. Dr. Moore emphasizes, never accept you're just getting older as an explanation for debilitating fatigue. Aging might slow you down, but it shouldn't stop you. The encouraging news? Many causes of extreme fatigue are treatable. David Chang, our marathoner, after treatment, he's back to running. Not marathons, but 5Ks. The key was recognizing that my exhaustion wasn't normal, he says. That recognition saved my life. Number 6, the night prowler, changes in sleep patterns. At 3:17 a.m., Helen Walker was wide awake. Again. The 66-year-old had always been asleep like a baby person. But for the past 3 months, she'd wake multiple times nightly, often unable to fall back asleep. I blamed it on stress about retirement, she says. I tried everything. Melatonin, meditation, even sleeping pills. The real culprit? Early-stage Parkinson's disease. Dr. James Liu, a sleep specialist at the Cleveland Sleep Disorders Center, reveals a startling fact. Sleep pattern changes after 60 are often the first detectable sign of serious neurological, cardiovascular, or metabolic conditions. Your brain doesn't suddenly forget how to sleep without reason. Here's what separates concerning sleep changes from normal aging. Normal aging sleep changes, taking longer to fall asleep, waking earlier naturally, lighter sleep, more bathroom trips, occasional insomnia. Warning sign, sleep changes, sudden onset of chronic insomnia, excessive daytime sleepiness despite adequate night sleep, acting out dreams physically, loud snoring with gasping, leg movements disrupting sleep, confused awakening, sleep schedule shifting dramatically, needing 10+ hours but still tired. The hidden dangers of sleep disruption after 60, REM behavior disorder, acting out dreams. 80% develop Parkinson's within 10 years. Sleep apnea, triples stroke risk, chronic insomnia, doubles dementia risk, restless leg syndrome, often signals iron deficiency or kidney problems. Excessive daytime sleep may indicate depression or cognitive decline. Carl Thompson, 70, tells a chilling story. I started punching and kicking in my sleep. Once I actually fell out of bed attacking an imaginary intruder. My wife made me see a doctor. The diagnosis: REM behavior disorder, a Parkinson's precursor. Early treatment has slowed progression significantly. What makes sleep changes particularly insidious is their gradual onset. Dr. Liu explains, by the time someone seeks help, they've often adapted to terrible sleep for months or years. They don't realize how impaired they've become. What time do you typically wake up during the night? Is it consistent? Share your pattern. Dangerous sleep pattern combinations. Insomnia plus weight loss equals possible cancer. Snoring plus daytime fatigue equals sleep apnea. Dream enactment plus tremor equals Parkinson's risk. Early waking plus mood changes equals depression. Excessive sleep plus confusion equals possible dementia. Susan Martinez, 68, noticed her husband's snoring had changed. It went from annoying to frightening. He'd stop breathing, then gasp, she recalls. Sleep study revealed severe apnea. The doctor said he was having mini-strokes nightly. CPAP therapy literally saved his brain. Your sleep assessment action plan 1. Keep a 2-week sleep diary: bedtime, wake time, night awakenings, dream recall, daytime naps, energy levels 1. Note any physical movements during sleep 1. Ask your partner about snoring. Changes 4. Track bathroom visits 5. Monitor morning alertness 1. Document any confusion upon waking. Dr. Liu's golden rule. If your sleep suddenly changes and doesn't improve within 2 to 3 weeks, investigate. Don't accept poor sleep as inevitable aging. The most overlooked sign? Timing consistency. If you're waking at exactly 3 a.m. nightly, that's not random, Dr. Liu notes. It often indicates cortisol rhythm disruption, blood sugar issues, or liver problems. Technology can help. Many smartwatches now track sleep patterns, revealing disruptions you might not consciously notice. John Davis, 72, discovered through his fitness tracker that he was having 30+ micro-awakenings nightly. I had no idea. I thought I was sleeping fine, just tired. Treatment for his undiagnosed sleep apnea restored his energy within weeks. Remember, quality sleep isn't a luxury after 60, it's a vital sign. When sleep patterns change significantly, your body is sending an urgent message. Listen before it's too late. Number 7, the silent scream. Persistent low-grade pain. For 6 months, Russell Edwards, 74, had what he called that annoying ache in his lower back. It wasn't severe, he explains, just always there, like background music you can't turn off. He tried heating pads, over-the-counter painkillers, even yoga. Nothing helped. When he finally mentioned it to his doctor, scans revealed multiple myeloma, a blood cancer that often starts in the bones. Dr. Karen Singh, a pain management specialist at Johns Hopkins, delivers a sobering message. After 60, new persistent pain, even mild pain, deserves investigation. Your body doesn't develop chronic pain without cause. Here's what distinguishes concerning pain from normal aging discomfort. Normal aging pain comes and goes, related to activity, responds to rest, improves with OTC medication, has clear triggers, familiar pattern. Warning sign pain, constant persistent presence, doesn't match activity level, worsens at night, doesn't respond to usual remedies, no clear cause, new pattern or location, gradually intensifying. The terrifying reality, persistent low-grade pain can signal bone cancers or metastases, pancreatic cancer, back pain, kidney problems, flank pain, aortic aneurysm, back abdominal pain, infections, inflammatory conditions, nerve damage. Joyce Patterson, 67, had persistent mild abdominal discomfort. It felt like I'd eaten too much constantly, she describes. I took antacids for months. When pain finally drove her to the ER, doctors found ovarian cancer. If I'd investigated that mild pain earlier, treatment would have been simpler, she reflects. Dr. Singh reveals a critical pattern. Dangerous pain often starts as an annoyance, not agony. It's persistent, progressive and peculiar, different from arthritis or old injuries. Do you have any persistent mild pain you've been ignoring? Where is it located? Share below. Red flags requiring immediate investigation. New headache patterns after 60, persistent chest discomfort, abdominal pain with weight loss, back pain that worsens lying down, bone pain without injury, pain that disrupts sleep, pain with fever or night sweats. Michael Chen's experience illustrates the danger of dismissal. The 72-year-old developed mild shoulder pain. I assumed I'd slept wrong, he says. When it persisted for 2 months, X-rays revealed lung cancer that had metastasized to the bone. That minor shoulder pain was my only symptom. The psychology of pain denial after 60 is complex. Dr. Singh explains, many seniors accept pain as inevitable. They don't want to be complainers or worry family. This stoicism can be deadly. Your pain evaluation, checklist 1. Document pain characteristics, location, specific, intensity, 1 to 10 scale, quality, sharp, dull, burning, aching, timing, constant versus intermittent, triggers and relieving factors 2. Note associated symptoms 1. Track pain medication effectiveness 4. Monitor sleep disruption 5. Record activity limitations, critical pain patterns demanding attention. Pain that's worse at night, pain unrelated to movement, pain with systemic symptoms, fever, fatigue, progressive worsening, new pain in multiple locations, pain with neurological symptoms. Dr. Singh's bottom line, never accept persistent pain as just aging. Pain is your body's alarm system. When it won't shut off, something's wrong. The encouraging truth, early investigation of persistent pain saves lives. Russell Edwards, mentioned earlier, his multiple myeloma was caught before major organ damage. That annoying backache I almost ignored. It was my body's smoke detector going off. Remember, pain isn't a normal part of aging, it's communication. After 60, any persistent new pain deserves professional evaluation. Your life might depend on listening to that silent scream. Remember Richard Hoffman from the beginning? After learning about these warning signs, ironically, from a video his daughter sent him, Richard took action. He started keeping a symptom diary, scheduled overdue checkups, and most importantly, stopped dismissing his body's signals as just aging. The results? His doctor caught pre-diabetes before it progressed, identified a thyroid issue causing his vision problems, and discovered his night sweats were medication-related, not age-related. Today, 6 months later, Richard just returned from that Alaska cruise. I almost became another statistic, he says, but knowledge truly is power. The transformation doesn't stop with Richard. Since we started this channel, we've received thousands of messages from viewers who caught serious conditions early. Maria, 71, discovered her fatigue was severe anemia, not just getting older. George, 66, learned his night sweats indicated a medication interaction his doctor had missed. Here's the powerful truth. Your body after 60 isn't betraying you. It's trying to protect you. These warning signs are your internal alarm system, designed to help you take action before it's too late. The difference between those who thrive in their later years and those who struggle often comes down to this: listening to these whispers before they become screams. You now have knowledge that could literally save your life. The question is, what will you do with it? If even one of these warning signs resonated with you, you owe it to yourself and your loved ones to take action. Start by doing 3 things right now. 1. Screenshot this video's chapter list to share with friends who need this information. 2. Hit the like button. It helps other seniors find this life-saving content. 3. Subscribe and ring the notification bell for more senior health insights. But here's the most important action. Schedule that checkup you've been postponing. Your body is talking. It's time to listen.